Time for our MU Healthcare segment, and we're happy to be joined by Dr. Ted Choma, and he is a back and spine specialist. So, let's get started right away on the first question, and you can get that microphone right up there with you. But when we say back and spine specialist, what does that all entail? Because you can go from one side of the rib cage all the way across the other if you're talking just back.
Sure. Yeah. So I'm one type of orthopedic surgeon and spend extra time training in surgery of the spine from the base of the head all the way down to the tailbone. So we treat a lot of people who have neck problems, lower back problems. Those are probably the most common things.
Mm-hmm. Okay. And where are you on the preventative side of things, or are you the when I've tried everything and now I need to schedule my appointment with you?
Yeah, I'm usually at the other end of that when preventative things have not gotten you where you need to be.
So back and spine, we hear people talk a lot, and the athlete is specific to a lot of our discussion, but you hear people talk, oh, back hurts, it's tight, it's all the rest. Yeah. So. For somebody, what are you looking for to determine whether or not we can go a non-invasive route, or we gotta? Sorry, you're going to spend some time on your belly here.
Yeah. So our first instinct always should be, can we treat this non-invasively without putting a needle in or doing a surgery? Mm-hmm. And luckily, most of the ailments that people will experience with their back and their neck can be treated without surgery. In fact, most of the athletes that I've seen with back and neck problems, we've done the same. We've been able to treat them without surgery.
Okay, some of the things that we will hear, bulging disc, herniated disc, slipped disc.
Yeah. So slipped disc is not a term that we use in medicine. It's probably a term your grandmother used.
Sorry, dusted that one off.
Yeah. Bulging disc is a term that a lot of people hear, and they're quite surprised to find that is simply a descriptive term when a radiologist was looking at their MRI and describing an aging disc.
Okay.
And so the older we get, we all have bulging discs. Herniated discs, though, that's a subset where a weak spot in the covering of the disc allowed some of the stuffing inside the disc to squirt out, and it's now pressing up against the nerve.
Okay, so the stitching came loose on the pillow.
You got it.
Okay. Now, do you restitch that stuffing or that pillow, or tuck the tiling back in? Or
even in those circumstances, interestingly, most people don't need surgery. Mm-hmm. We can take care of their symptoms, help them get through it without surgery. But a subset do need surgery, and when we do that, the most effective thing we do is get the pressure off the nerves. People have tried to restitch the covering. Doesn't seem to work too well, but luckily the scar tissue that forms after a surgery seems to do the trick.
And that's one of the few times where scar tissue would end up being beneficial then.
You got it.
Okay, Dr. Ted Choma with us here, MU Health, orthopedic specialist in back and spine. We can kind of go through a couple of things. We saw last night, we heard all the descriptions of Max Scherzer and his neck and his back issues and a cortisone shot and all that. So, from the outside looking, I'm not asking you to diagnose this, but what is that process as you work your way through to, okay, a cortisone shot should work here? Yeah,
so different structures in the neck can give you pain that you feel around your shoulder blade. And so that's not that an uncommon scenario. And you could tweak some of the ligaments that are attached in the neck bones. You could get a little partial tear of some of the connecting tissues. And in those cases, a cortisone shot calms down the inflammation. It's like taking the world's biggest Motrin and putting it right where you think the problem is.
And that's key, though. It's right where you think the problem is, because you've got to dig around to make sure it's going to the right spot, correct?
Correct, yeah. When people get injections in the spine, it's usually done most safely with a live X-ray in a room, so that the doctor's watching on a TV screen right where the needle's going, so they know exactly where it's going.
Okay, Dr. Ted Choma with us here. All right, the herniated disc, you hear a lot of, especially athletes, high-end athletes, lower back issue, and a lot of that is because they go vertical and they slam back down again, and that shock absorber begins to start wearing out as you go. So how does that low back then get treated, especially for an athlete who's wanting to get back to competition?
Yeah, so Again, our first instinct is usually to try to treat them without surgery. Most of the time, luckily, we can do that. Rest the athlete. If you can identify right where the problem is emanating, you could put a directed injection there, a cortisone type injection. But if you have to bite the bullet and do a surgery to take pressure off a nerve, then the athlete's going to be out for usually a couple of months.
Rehab on something like that, how does that get handled? Because you think being up and about, and then back, spine, that could be problematic.
No, actually, we do get our patients up right away. So after whatever treatments we do, whether it's medications, injections, or surgeries, patients are getting up and moving around the very same day. We have to be careful with them so we don't let them overdo things. In our high-end athletes, often they have trainers that are supervising them, and so our conversations are with the athlete and their trainer. And really, it's focused on them getting back control of their core muscles so they can protect their joints.
Okay, and that actually leads me to this next question here is, I know you don't want to be terribly busy, so how can the common person keep you from being busy? What are some of those exercises to keep that back in good shape so that they're not spending quality time with you?
Yeah, so paying attention to core strengthening is without a doubt extremely important. And unfortunately, most of us have jobs where we sit behind a desk. And so during the day, the work that we do for employment usually is not sufficient exercise. And so finding a way to do some aerobic exercising and finding a way to do some light resistance exercising, those things will keep the core toned and will protect the joints in the spine.
Okay. Now, I had an incident in a football game I was covering a couple of weeks ago where the player went down and everybody just, they all stopped. And they ended up backboarding him and taking him up here to University Hospital. For somebody who is out there on that field, what's that process? How do you go about making that decision? And then what do you do?
Yeah. So if there is a physician at the game who's covering the game, they'll usually run that process. But many of our games don't have a physician there. Right. And so the trainers are trained in this exact scenario. They understand if it's a football player, how to safely get them on a backboard. Everyone knows that if there's a suspected injury in the spine, you don't want to make it worse before they get their definitive treatment. And that's why they take their time, they know their steps, they practice this before the season starts, and they can safely get the athlete onto a backboard and get them to help.
So, and there's been just a ton of innovations, especially on the NFL level, of having facilities right there in the stadium. And I know that's incredibly expensive. You're probably not going to see that trickle down to the high school level, but on the collegiate level, what are some of the changes that you've just seen in the last couple of years that have really improved the prognosis for back injuries?
Yeah. So interestingly, one of the changes was probably a little serendipitous here. Was building the Missouri Orthopedic Institute right across the street from the athletic complex, and so a few weeks ago we had a star athlete on offense and defense go out, and they were able to get across the street and get MRI'd before the game was out. That is pretty high level diagnostic capabilities, and I would say not every Power 5 team can do that before the game is out, but we can do that here.
Dr. Ted Choma with us here, MU Health, orthopedic surgeon, back, neck, spine. So as let's look like 5 years out on the athletic competition field, what are some of the changes that you expect to see or hope to see?
Well, I think there's a lot of attention on how to make the collision sports safer, and by athletes being able to wear accelerometers, whether they're in practice or in game situations, it's allowing people to learn how to make the game safer. I think we'll see that over the next 5 years. I also think that we'll see some more portable sensors that trainers and physicians that are on the sidelines will have with them to make more concrete diagnoses before they even get the athlete off the field.
Does that help you? Does some of those innovations like the accelerometers and that, does that help you in your job?
Well, it would help me from the standpoint of keeping patients out of my operating room. It's I can tell you. I spoke to a neurosurgeon at Wake Forest, and he was doing a project putting them on the Pee Wee football players.
Really?
And it was really eye opening to see how many collisions those kids sustain even in practices.
Yeah, and we're talking about, they're still kind of made out of rubber at that stage.
Yep.
So, all right, Dr. Ted Choma.
When you're evaluating these injuries, and whether it's football, hockey, maybe wrestling, what's kind of the incorrect positioning that they're putting their backs in that causes these injuries in the first place?
Yeah, it usually isn't incorrect positioning.
Gotcha.
Usually what's happening, the core muscles that attach to the spine, those muscles are extremely important at protecting those joints. What typically happens is some of those muscles get driven to fatigue. And if you'll notice, quite commonly, most of the injuries that you'll see on a televised game occur near the end of the game or in the fourth quarter, right? Because athletes have driven their muscles to their fatigue point, and the next time they make a demand on them, they can't protect the joint anymore. So it's not, in my experience, the athlete doing something wrong. It's simply driving their body beyond the point that it can protect the joint.
So the athlete or the layperson can do a whole lot to make sure that everything is done by making sure that they get their exercises in, and when you hit that fatigue point, take a break.
That's right. So so paying attention to your conditioning means that you will go a lot longer before you hit that fatigue point.
Okay. All right, Dr. Ted Choma, MU Health, orthopedic surgeon, back, neck, and spine. Thank you very much. I appreciate it.
Pleasure to be here.